We wanted to look at maternity services on a national level so that we could get a very good idea of what the problems are as a national overview, and also looking at where services were doing really good things so that we can then use that to improve services for women.
What we found was a lack of understanding that triage is about emergency care. It's where women attend because they've got a concern or a problem and it's unscheduled. They need to be able to have access 24/7 by telephone and in person so that they can be assessed, reassured or receive early treatment.
We found some issues around not all services having a standardised risk assessment tool, and there wasn't a standard way where all services could prioritise women according to their clinical need.
Also, there is issues around staffing. In some services, there is no adequate midwifery staff covering the triage telephone lines. That means that you have women that might be calling the triage and it can be answered by someone that's not a midwife.
Where they haven't been seen promptly or had their care need escalated to a professional such as the doctor or a senior midwife, it can and has resulted in stillbirth, early labour, delivering outside of the labour suite, hemorrhage that has gone unnoticed, and women have been admitted to intensive care units and babies to neonatal intensive care units when they might not have needed to at all. There are some really good services out there, and that's important to note.
A good triage should have adequate, competent midwifery as well as medical staff in triage. We also want to ensure that a good services should have a standardized tools or protocols or processes in place to assess as well as prioritize women presenting in triage.
We've seen services where call handlers are set up in the local ambulance stations, and that means that there's always somebody on hand to answer calls. They will have a really comprehensive list of questions where they're asking women and they're taking a really good history, so nothing is getting missed off that list. So when the women attends a triage unit, they will get seen quickly by the most appropriate person.
Trusts can demonstrate evidence of effective triage services in a number of ways. They can ensure that they have a clear process and procedure that's understood by everyone and is followed by all staff according to their job role. Ensure there's a 24/7 service and that staff are ready at all times to be supportive, no matter how small or large their department is.
One of the main ways that trusts can demonstrate that they've got an effective triage service is obviously from feedback from the people that are using their service. So how do women feel about their experience? Have they felt safe and well looked after? But it's also that governance portion of the work, so looking at audits, what are waiting times doing, how long does it take to see a doctor, have you got enough staff, are staff ring-fenced to work just in triage, are they getting pulled away to work in other parts of the service? So all of these things are things that providers should be looking for and they should know to be able to understand their service and to work more effectively.
The way I see triage or how triage looks within maternity services is like the A&E into maternity or the emergency departments. It's really crucial to use it to identify, but also to manage any risk to women that are presenting within the services.
Women need to be seen in a consistent way, and they need to be seen according to their clinical need. That is where the door opens for women on maternity services if you have any kind of concern or problem. Women don't call triage because they feel well. They call triage because they're worried about something, they have a concern, and they're seeking help and they're seeking reassurance.
By having effective triage services, we found that there are less harms to women and their babies. It ensured that women could be admitted at the right time and have their babies safely and go home with that bundle of joy that they wanted to have.